DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're going to have a great show. Dr. Halden Clark from the Great Plains Veterinary Education Center is going to join us today. We're going to talk about summertime pneumonia in calves. It's going to be a great show. Thanks for joining us, and we'll be right back.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson, and I'm here with Dr. Halden Clark. And Dr. Clark is the health stewardship veterinarian here at the Great Plains Veterinary Education Center with the University of Nebraska at Lincoln. We're here just west of Clay Center, Nebraska. If you want to talk about history of veterinary medicine and bovine medicine and student education, you won't find a place on the planet that has a deeper, richer history than right here. Thanks for being here.
Yeah, absolutely. Glad to be here.
It's great. We're going to talk about something today that interests me. Dr. Clark wrote an extension bulletin that caught my eye, and the calls that we get on summertime pneumonia in baby calves. It's not something that's new, but it's something that just is kind of lingering and keeps rearing its head, right?
Yeah, that's exactly right. We're used to talking about BRD at feedlot arrival, post-weaning, but actually summer calf pneumonia is a real problem as well at times. Not in comparison, not as big of a problem, but something that does appear to claim about $165 million a year from the beef industry. So not insignificant, and it tends to strike fairly sporadically across the Plains states. One study showed that about 1 in 5 herds is going to face summer pneumonia in their nursing calves in a given year. And then across larger herds with multiple production units, like smaller individual herds making up a larger overall herd, it may be unevenly distributed, and some groups may have a lot more of it than others. So that tends to be kind of a framework for the way we see it crop up.
Well, and I've received calls from producers all across the Midwest and the Western states this year talking about summertime pneumonia, and just like you said, they have cattle in different traps or basins, and it happened where they put the steer calves this year, and over here where they sorted and put the heifer calves, we aren't seeing the same issues, and so it's something that can be quite taxing on your brain trying to figure out why is it over here and not over here, or why this group. And I think that's just kind of the way health in general goes sometimes.
Yeah, absolutely. There are the risk factors that we know about and the things that we can control, but then biology ends up setting our schedule for the day, and we don't always get exactly every answer that we wish we could, don't we?
Yeah. So when we start to talk about some of those risk factors, what are some of the things that have been associated with summertime pneumonia?
Yeah, so some of the things that make the list would be, first of all, anything related to the overall health of the herd. So we have to think about colostrum quality and the things that go into that, such as the nutrition of the cow, the vaccination status of the cow. Those things are important. Beyond that, we're going to go into things like heifers are calves born to heifers are at a slightly higher risk of nursing calf pneumonia than calves born to cows, which makes sense. The heifer colostrum is probably not quite as potent. The heifer hasn't had a long enough lifespan to build immunity to everything that's in her environment. In addition to that, things like commingling in any form or fashion, so things like estrus synchronization, congregation around water tanks, in the shade, around feeding areas, things like that are going to shipping stress if the group is moved from one area to another. All of those are believed to increase the number of effective contacts, maybe nose to nose, maybe at the water tank, chances for pathogens to spread between calves. So
perfect. Well, that's a great place for us to take a break. We can come back and we can talk a little bit more about those risk factors and then jump into maybe what we see as clinical signs in these calves. You're watching DocTalk, Dr. Halden Clark, GPVEC. We'll be right back after these messages.
This Cattle Intel is brought to you by Neogen.
Hello, Dr. Nick Wagner here, Professional Services Veterinarian with Neogen, and I'd like to discuss a few needle usage tips. When selecting a needle, you want to select a durable, sharp, and detectable needle. A few standard practices are to avoid contamination, avoid burred needles, avoid bent needles, and definitely change needles in order to prevent broken needles. When we look at changing needles, if you're dealing with any bloodborne pathogens within your herd, you need to change after every animal. And those would be diseases like anaplasmosis or bovine leukosis. If you're not dealing with anything like that, then you can look at utilizing a needle for potentially 10 or 15 injections. But also another rule of thumb would be if you're using a multi-dose syringe to change the needle when you refill the syringe. So a couple guidelines there on that. The other important thing to consider is to keep records of treatments, and the other aspect is to ensure that your syringes are properly cleaned and properly calibrated. But if you do these things, along with selecting a needle with the proper gauge and length, it'll ensure safe and effective injections.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
John McCurry with McCurry Angus Ranch. We are standing right now in our fall yearling bull pen. On our first initial run with therapies, we commingled 3 separate different pens of bulls together for the ones that's in the sale, and had virtually no issues with these cattle in terms of commingling them and their attitudes towards each other. Didn't have the riding and the fighting that we normally can experience. And I would highly recommend us using therapies, and would recommend that to anybody else looking to do so.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson with Dr. Halden Clark. We're outside of Clay Center, Nebraska, where Dr. Clark serves as the health stewardship veterinarian for the Great Plains Veterinary Education Center, held here with the University of Nebraska-Lincoln and USDA Meat Animal Research Center. Just an unbelievable facility, and just a treasure for the research that is the foundation of our meat industries and also veterinary medicine. So when we were on break, we talked a little bit about, I'd said one person has it in the steers and another person has it doesn't have it in the heifers. But there's actually some proof to that. Yeah,
that does seem to be what we find, is that the steer calves are at a little bit higher risk of showing up with summer respiratory disease than the heifer calves are. So if you're short on labor and needing to pay more attention to one group, it may be the group that has more steers in it. Yeah. So it's just fundamentally, we're learning every day, folks, when it comes to veterinary medicine and health of cattle. And not all cows read the book. That's right. And every herd's different. And so working with that local veterinarian is vital.
Let's talk about clinical signs. What are some of the clinical signs that generally in the summertime pneumonia?
Yeah, so often these calves are, one thing that's important to think about when we talk about clinical signs is where we're at in the course of disease. So early in the course of disease, one of the ways we like to put it, and I didn't make this up, and I don't know who to source because I can't remember, but somebody said the calves to look at first are the ones that just look like their favorite team lost a football game. They just look a little off. Not anything that really jumps out at you, but they just look a little off. Those are the ones to pay attention to first. Later in the course of disease, you'll see worsening signs of illness. You might see a cough. You might not. You'll see a listless calf. You're going to start to see some exercise intolerance. So if you move a group from one place to another, you might have a straggler, and that'd be one to look at really closely. Eventually, later in the course of the disease, once more damage has accumulated, you might see the ears down. You might see a thin calf, one that really looks terrible. And by then, we're later in that disease progression, and we have a much more debilitated calf, one that's going to be harder to achieve a full resolution of that case of respiratory disease. So that's a little bit about how things look at various points in the process.
Well, I think it's important to understand what we're looking for. And then the other thing that we had discussed is that calves that go through a diarrhea episode, or if we have a scours outbreak, there tends to be a little bit higher prevalence of subsequent summertime pneumonia.
Right. Yep. That first month of age is typically where we're going to see scours, neonatal calf diarrhea. And then a little later in the summer, somewhere around maybe 2, 3, 4, 5 months of age is where the summer pneumonia seems to pop up. So if you have a group that struggled with scours, that's one to pay special attention to the rest of the summer, because they may be set up for respiratory disease as well.
That's perfect. Well, folks, we understand its importance. We now have some clinical signs and understand what we're looking for. When we come back, we're going to talk with Dr. Clark about treatment and then subsequent prevention. You're watching Doc Talk with Dr. Halden Clark. We're glad you joined us.
Every farmer knows that understanding the landscape is the most important ingredient for success. When it comes to investing in precious metals, United Patriot Coin can help steer you in the right direction. No obligation, just solid advice. Call now for your free guide, 844-202-7834.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cuperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Ranchers, looking to elevate your pasture management game? Turn to Halden Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Halden Brothers has your pasture covered. Visit HaldenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Halden Clark, and we're at GPVEC, Great Plains Veterinary Education Center, where Dr. Clark is a health stewardship veterinarian. He teaches a ton of students. He's out on farms around here providing veterinary care teaching at a very high level, providing CE for veterinarians, and much, much more. And so University of Nebraska-Lincoln did it right when they developed GPVEC, and we're very fortunate to have Dr. Clark here as one of the people that is a go-to people for people like me to get more knowledge, to do a better job for clients.
Well, thank you.
So, all right. So diagnostics first, right? My dad used to say it's easier to sell a vaccine for a few $1,000s than it is to sell a diagnosis for a few dollars.
Right.
And if you'll let us as veterinarians do some diagnostics, we can help hone in on some of the reasons that the calves are going through this, right?
Yeah, that's absolutely right. There's a list of pathogens that can cause this, sometimes alone, sometimes in unison, but it is helpful to have some information about that. We break the diagnostic plan into two main areas. One would be antemortem, where the calf in question is still alive, and we need to see what pathogen may be affecting the calf right then. The other time we would potentially take samples and get a better sense of what's going on with the calf would be postmortem. If we have one that actually passes away due to the disease, or that we end up needing to euthanize, then we can take direct samples of lung tissue from that calf. So on the antemortem side, something like nasal swabs that are submitted for a PCR test would be a reasonable sample for this calf. And then on the postmortem side, having your vet collect lung tissue and send that off for PCR diagnostics would be very reasonable as well. A few things to keep in mind about necropsy and summer calf pneumonia is that typically, like the name, this is occurring in the summer. And so that carcass will autolyze, meaning basically decompose or rot very quickly in the summer sun. So you basically have hours, not days, to get that calf to a veterinarian for a necropsy. Now this is, as a disease itself, respiratory disease in these calves can be diagnosed with a high level of accuracy on necropsy, even just a gross necropsy without sending off samples. We can tell if this calf died of respiratory disease or something different based on how the lungs look, but that can only happen when the carcass is very fresh. After it's had time to lay in the sun for a while, it's going to be the organs are going to get gas bubbles in them, they're going to discolor, eventually they're going to lose their tissue integrity and fall apart completely. So
what are our main pathogens that we're going to isolate or be looking to isolate, or that are of interest in summertime pneumonia?
Yeah, most of our classic BRD pathogens are still at play here. So Mannheimia hemolytica is going to come to the top of the list, Pasteurella multocida, Histophilus somni, and then also some of the respiratory viruses. So bovine coronavirus, that's on the list, and then also BVD, BRSV, and then IBR as well. That's kind of the common list of BRD pathogens.
Designing a treatment program, I would assume then, is similar to designing a BRD. Once we know it's a bacteria, getting the right antibiotic and getting those calves treated early is important.
Exactly, and emphasis on the word early. Yeah, if we can treat this early in the course of disease, we often have very good clinical outcomes. And then, like so many things, if we're treating very late in the course of disease, after the damage is basically done, our success rate is much lower.
Perfect. Work with your local veterinarian, get a prescription, get the right antibiotic to treat the calves early. When we come back, we're going to wrap up with Dr. Clark talking about how we prevent summertime pneumonia. You're watching DocTalk, and we're glad you joined us.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
One animal has this huge impact on your operation.
BVDV is one of the most costly bovine diseases, with losses of $15 to $88 per head.
The virus will actually cross the placenta and get into the fetus. As it's developing, its immune system will recognize that virus as it's supposed to be here. And so then that's where our persistently infected animals come from. They're going to shed that virus their entire life, and then it's going to impact your operation.
It is important to work with your local veterinarian and partner with IDEXX for the best solution for your operation.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson here with Dr. Halden Clark. We're at Great Plains Veterinary Education Center outside of Clay Center, Nebraska, run by the University of Nebraska at Lincoln, where Dr. Clark serves as the health stewardship veterinarian, and he's got a big job. He's got a lot of students, got a lot of teaching, got a lot of veterinarians, a lot of research projects, just all the above. And so thanks for carving out some time to spend with us. It's been great.
Absolutely, yeah. Glad to be here again.
It's good. So prevention, we go back to some of the risk factors we talked about, and you just kind of put it in reverse, right? We'll fix them. But
Right.
what are some things that are core to this calf health program?
Yeah, so some of the things that come to mind right away. One thing I like to tell students is that pneumonia, in many places that we see pneumonia, it's a disease of stacked stressors. So when we have what seem like low-level stressors, but they accumulate, they're more than a few happening at once, that's when we typically tip animals into respiratory disease. So for starters, we want to maximize the health of the animals. That's going to start with a nutrition program, a herd health program, vaccinations, dewormers where applicable, and all of the rest with your herd veterinarian. And then it's going to involve dotting your I's and crossing your T's with regard to husbandry as you approach events that you know are going to be a stressor. So we talked about in the summer, one of the major stressors for a ruminant animal is heat. So shipping cattle during the cooler times of day, making sure that they have water access as soon as they can after the shipping event takes place. Those matter. Those things make a difference. As we optimize nutrition, we're going to be optimizing the colostrum quality that those calves are going to receive from their mothers, optimally vaccinating the cow so that she transmits immunity to her calf via the colostrum. That's going to be very important as well. So all those things are they're gonna play together. What we're trying to accumulate is momentum, health momentum, that's going to carry us through some of these problems and see us through to the other side with minimal speed bumps.
Well, I love the term health momentum. That one I may steal from you. But as we start thinking about this, one of the things we talked about is that we vaccinate the cow for a couple of reasons. One, the cow can be the Trojan horse that carries the virus and it doesn't affect an adult, and they can shed it in the environment and the calf picks it up, but the calf is naive and it can. So vaccinating the cow, we want to clear the cow. Like when we talk about coronavirus vaccines, we're vaccinating to clear the cow of coronavirus, but we're also putting that coronavirus antibody in that colostrum to treat that calf during the first 3-4 months to prevent the scours and subsequent respiratory disease. So just things that you can think about. But nutrition, if we don't have good nutrition and good hydration, it doesn't matter what we vaccinate them with.
Mm-hmm. Yeah, that's right. Absolutely. And one comment on the vaccination front is that this is a disease that we're not going to be able to 100% vaccinate our way out of. It is going to occur even in well-vaccinated herds, but we're hoping just to maximize health of those animals, and when cases occur, we want those to be treatable, to resolve quickly, and for the animals to move on to productive lifespans.
Well, I think the other thing that you've said that has really driven home for me, we know there are events that we're going to do in our production systems that are going to cause stress on the baby calves. And if we can decrease the stress, do it at times that it's cooler, do it quicker, maybe working in smaller groups to decrease the amount of time, be very, very diligent in our transporting of these animals, not overstocking the trailer. All these things will decrease your summertime pneumonia prevalence.
Right. Yep.
Dr. Clark, I can't thank you enough for being on the show.
Absolutely.
It was great information, humble man with a lot of knowledge, great cow veterinarian, and we're glad that we got to spend time with you today. Thank you for watching Doc Talk. Remember, if you want to learn more about what we do, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. And I'm Dr. Dan Thompson here with Dr. Halden Clark, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.